Tom, thank you for sharing with us the learnings you've gained from working with people as a peer mentor and as a person yourself with lived experience of spinal injury. I believe you sustained a spinal cord injury in 1991, and you're currently working and have worked for many years at the Ann Arbor Centre for Independent Living, and you provided their peer support program and mentoring program since 1997. You're also a disability living consultant with them, and co-lead and teach and provide a research assistant role in terms of the Model System Advisory Board, and you really bridge the gap between stakeholders and clinical staff. You also have worked with the Christopher and Dana Reed Foundation for peer and family support programs, so have a wealth of experience that you can share with us in terms of thinking about the developments of peer support programs and education programs during COVID-19. And this will provide significant insight for us all as we continue to work with people with spinal cord injury during this ongoing situation. So thank you for your time today. We're looking forward to learning very much how to translate that into our clinical practice.
Thank you, Jane. It's my pleasure to join you.
Thank you. Could you firstly explain the transition that you've undergone in terms of the program you've got to a virtual format for mentoring and support groups?
Sure. I think for everyone, it was quite a transition to move from in-person to virtual services. And so some of the barriers that we found were that some of our peers didn't have equipment, didn't have smartphones, didn't have tablets, and so forth. And if they did, some didn't have access to the internet. So there was a learning curve, and also providing resources for them to possibly obtain scholarships to equipment, whether it just be a smartphone and the service that comes with it, or a tablet, or a laptop, and then getting them internet service so they could join a monthly program or do a Zoom type interview with their peer mentors. So moving to that was quite a challenge. Once we got it, it worked very well in a group situation and in a one-on-one mentoring situation.
And what would you say were the unique concerns for the spinal cord injury community during the pandemic?
I think that if I boiled it into one word, boil it down to one word, it would be isolation. And I think that we all, in terms of both the disabled community and the able-bodied community, if you will, we all sort of suffered from isolation, even if you had family with you. But a lot of us live alone, and the only people we see are caregivers, if we have them. Folks that are very independent don't need caregivers, so they may not see someone at all for periods of time. And just like around the world, we had very strict guidelines on what we could and couldn't do. And so we couldn't leave the house, and basically stay on your property is what most of us went through. So we all know that isolation can lead to depression, and it came sort of at a time when most people are starting to get out. It came in March, as we know, in 2020, and that's when we like to start getting out and doing things from a long winter. And so that played a part as well. But things like self-efficacy went down because you didn't have the supports of your peers or professionals. I think it was quite a transition to start meeting with your physicians and clinicians via telemed through virtual means. And so I think that was very hard for people to transition to and realize that it was private and only shared between their clinician and themselves in these Zoom telemed type appointments. And so everything was just such a transition to doing things differently. And even I, as a professional, have issues with change. And so that was very difficult. But some of the things that came up in our mentoring sessions and in our virtual support groups were things like increased anxiety or paranoia, if you will, on things like your caregivers coming in and out. We knew that they were seeing other patients. And so there was this anxiety about, what are you bringing into my home? You know, have you washed up? Have you used hand sanitizer? It's very hard to produce a 6-foot difference when they're a caregiver. They're working right with you, and in some cases hands-on. And so there was that issue. There was, how do I get groceries? And how do I get my medications? And, I think a lot of us thrive and survive, if you will, on interacting with our peers. And that wasn't happening. There were no groups to go to. There were no sporting events to attend or participate in. You couldn't hop on your bike and go ride your bike with friends. And we all know that fitness is, produces endorphins that help us, move along at a good rate, psychosocially, if you will. And many of us rely on gyms, and the gyms were closed. And so those are some of the biggest issues that we faced. And it was strange, because if I was suffering myself from living with some of these same characteristics, I had to sort of hide that or put that aside to a degree to be able to interact with folks and and help them out. Though I did also bring that into consideration when we're living shared experiences with each other. So I sort of rode that line from the professional facilitator of the support group to being personal with a one-on-one.
So the support groups really provided a vital lifeline in terms of that isolation that you described people experiencing, and helping people, it's from what you've said, really maintain their self-efficacy during an extraordinarily difficult time of their lives, not just as an individual, but globally and as a community.
Correct. Yes.
And can you tell me what you have found helps people to discuss and learn about self-management and social problem solving? Because I know you've done work in relation to bladder and bowel complications, and how that has helped inform you in relation to the work that you've recently done.
Yes. So I'm really lucky to be working with Michigan Medicine and with the University of Michigan. And so I have a lot of knowledge and an access to a lot of resources right at my fingertips. And so it was all about getting vital information to folks in real time. And so we would gather with support groups, and we're lucky in our local community that we have 2 separate spinal cord injury support groups. And so that every 2 weeks, we had this ability to come together as a community. And so what we found was that we would problem solve together, whether it be, I'm having a UTI and, I can't reach my doctor right away. And how do I, submit a sample, a specimen to get that read for an antibiotic, or I'm having complications with my bowel program. These are things that a lot of folks don't take into consideration when they see someone with spinal cord injury at the complications that we live with every day. And so these were, like you said, a lifeline to discuss and problem solve together. And it's funny how you get a bunch of people with spinal cord injuries together, and the things that we'll talk about that in any normal circumstance, you don't start talking about your bowel and bladder habits with other folks. So those one-on-one peer mentoring programs and the support groups were that lifeline to problem solve on all kinds of complications that we were living with.
Tom, thank you so much. If there was a couple of key take homes that, because the pandemic is running on, and particularly at the moment in relation to India and our colleagues there, some key things that you would recommend for people going forward, for peer mentors going forward and reaching out?
I think to keep in mind that although things are opening up and restrictions are being lifted, and many people, at least in the United States, have been vaccinated already. I think we're at 50% of Americans have had at least the first shot, if not fully vaccinated. But I think it's important to continue with these virtual options because, you know, we're still mask wearing out in the community, and we're not ready to have an in-person support group yet. Or really in-person one-on-one mentoring, especially at the hospitals. And so I think to keep in mind to continue this virtual connection because it's really been a unique and efficient way of connecting with folks. And you know, you're not driving to places and you're not necessarily getting ready, but I think it's mostly that. And I think for everyone to keep in mind that there are resources out there for survival. And we don't know how long this will go on or variants will come up. So keeping those things in mind that there still are protocols to keep in mind.
Tom, thanks so much for giving us your peer experience and your lived experience as part of the three keynotes that we've got about decision making from Professor Tate, and also Dr. Carrie Pulaski is now going to talk to us and share her experience of advocacy with disability during the pandemic. Thank you for your time, Tom. We really appreciate it, ESPA.
Thank you so much, Jane.